Other bases, and that certain dentists that we might know say that we need to get this taken care of. Now, we're talking about grinding our teeth.
Well, you said I do it too, right?
I think so, yeah. Yeah, I mean, so there's a lot of signs too. It's not something that's really kind of hard to figure out. I mean, teeth are not flat, right? I mean, they don't all flat, they're not flat and they don't fit together like this. They have, you know, character. I mean, there's, you know,
we're omnivores.
Peaks and valleys.
We're designed to eat vegetables and
We're
fruit.
designed to have like a kind of almost like a mortar and pestle. I mean, you know, we have cusps that come down into valleys that mash our food up, so we can actually, you know, like
chew.
Yeah. So we can chew meat essentially. I mean, and harder things and that kind of thing. So if we don't have those teeth, then we have a hard time. But if we flatten them all off, it's also harder to eat. And we have a lot of. There's actually. I'm not going to bore you with the whole stuff, but there's 5 categories of normal teeth. So there's normal bite with you know, when most people have had braces, that's kind of when they have normal teeth and normal bite, normal bite. And then after that, there's categories of kind of diminishing, sort of like you would have different diagnoses in medicine. So there's different, so there's small bite problems, and then there's massive bite problems, and then
so different stages of bite problems.
Yeah, and when you get to the 4th and the 5th, what happens is it's actually kind of a brain issue. So people that grind and clench their teeth and really actually rub off that tooth structure or grind off that tooth structure, those people actually, their brain is telling them something, and so they're having that grinding. A lot of people think it's stress. A lot of people think that it is related to sleep apnea. So that grinding is a response that the body has to try and get you to wake up when you're not breathing at night.
I blame it on broadcasting myself.
It could be broadcasting. It could be, you know, but it's stress. I mean, you know, you know, we all want to go back to childhood because there's less stress, right? Yes. I mean, you know, so as adults, we have different pressures and different stresses, and that sometimes can manifest itself in clenching and grinding. And a lot of people do it during the day and kind of realize that they sort of do it. Most people do it at night, and they have no idea that they're doing it while they're sleeping.
I'm sure most
they have
people
no
like
idea.
me don't believe you. They're like, you clench or you grind your teeth.
There's a lot of denial. It's kind of funny.
Can you hear somebody doing that? Can you hear somebody grinding their teeth?
So if you have a partner and you're sleeping next to somebody, generally speaking, you'll kind of hear it early on, and then you'll get used to it. So sort of like a pager going off in the middle of the night or something like that, you know, so that kind of thing. But what really actually happened, because people will say that, oh, I think I used to do that, but, you know, my spouse says that I don't do it anymore or something like that. Well, they've usually just gotten used to it. And sure, there can be ebbs and flows to it. There can be times that people do it more than others, but it can be very, very, very destructive. And if somebody doesn't know that they're doing it, and you're not, I mean, let's be honest, people skip visits to the dentist. I get it. I mean, we have people all the time. They're like, I haven't been here for 10 years, and I can't believe it's been 10 years, and I'm so sorry.
You're like, well, it looks like it.
Well, no, I mean, I would hopefully not say that, but
no, usually it's like, I know what you're talking about.
No, not at all. As a matter of fact, I mean, there's so many things that, you know, are so preventable and so manageable over, you know, short periods of time. That's a good thing. But if you let something go too long, then you can have
what's the worst that can happen?
problems.
You grind your teeth, so big whoop. No, so what's the worst?
Mass destruction.
Well, and along with that, I find that it costs me money. Because over time, it's hard on your fillings, it's hard on your crowns.
It does. And that's what, you know, we've had the discussion before about just a simple,
look at this.
Just a simple night.
Oh my goodness.
Yeah, a simple night guard can really keep that from the teeth from grinding on each other.
That's from grinding?
Holy cow.
Yeah. Well, think about it. What else could it be from?
Right.
I mean, there really isn't anything else.
I mean,
because it's uniform. You can see that the teeth all match. I mean, when you actually put them together, they match.
Oh my goodness.
Yeah. So I mean, it's of course other neglect and that kind of thing. This is obviously a lot less severe, but also creates a problem.
So if you have the disformation on the ends of them, that could be an indication that you're grinding your teeth. Yes,
if your teeth are flat across like that and they match when you put them together, they match because when you really put them together, they shouldn't match like that. They should, the canines or the pointy teeth should actually kind of come across each other and kind of have points together.
Yeah, because I have a little hole in the bottom of my canines.
Yeah.
Is that a sign of it then?
Can be, yeah. I mean, if you we call them wear facets.
Okay.
So it's like it's a kind of a divot.
Okay.
Yeah.
Are there other signs, like if you're by yourself and you don't think you do it or you don't know?
So one of the major signs is that actually waking up with soreness or headaches. So a lot of people are sore in their face or their neck or their head when they wake up. Why would you be sore in the morning when you just rested? You know, I mean, you shouldn't really feel like that. I always tell people that if you clench all of these muscles and all of all these are muscles that connect our teeth together, and it would be like, lifting a weight all night long. This muscle would be on fire.
Right.
And so, aren't these the strongest muscles in your body?
They are, pound for pound. They are the masseter muscles. They're very, very strong. So it's something where a lot of people just think, well, I just wake up with headaches. It's no big deal, or I just get headaches. Well, headaches are a sign that something's going on, and a lot of times it's muscular. It feels like it's inside your head because it's pounding and it's sore and it's, it hurts, right? And but a lot of people don't realize that waking up with headaches is a sign that something's going on during the night that is causing trouble. And often it's muscular. Often it's these muscles that are back in the neck or in the head or, attached to the teeth. When you really clench all of those muscles, you can feel how many there are and how much.
Okay, so
how tight they can be.
You figure out you're grinding your teeth.
Yep.
What can you do about it?
You find out you're grinding your teeth, obviously see your dentist, see if there's something that can be done, like a night guard or we call them an orthotic or a splint, to just protect the teeth. I mean, to just keep it from happening. And like Jason said, keep from breaking teeth, or people think that breaking a tooth is a normal thing. Well, it really isn't all that normal. You really shouldn't break something. I mean, sure, there's weaknesses in teeth and that kind of thing, but you really should be able to chew pretty normally and function pretty easily without that. So, I mean, without breaking.
If you're breaking crowns, would that be?
It's really hard to break a crown.
Broke two.
Yeah.
And they finally put a gold one in then.
Yeah, and again, so I mean, there's three reasons that people lose teeth. It's decay or caries, periodontal disease, gum disease. You lose the bone support on the teeth, and force. Force is one of the major ones that's overlooked, even sometimes by dentists. So a lot of times they're just like, oh, you're fine. And we see, sometimes you see somebody for a few minutes at a checkup and you really don't think about it, but it's really something that we see a lot of. And like you saw on the pictures, it can be very destructive.
Now, obviously, you wear the guards at night while you're sleeping.
You wear the guards at night. Some people do wear them during the day.
I say, what about if you grind your teeth during the day?
Some people do wear them during the day, and strangely, a lot of people wear them at the gym because when they're weightlifting, they're clenching, or I mean, so. There's a lot of things that can be done. So just, have a conversation.
Wear them if we're in meetings here.
Yeah.
That's when
you get stressed out, yeah.
I think everybody should wear them during meetings, maybe.
All right, so people want more information on grinding teeth or what can be done or anything in general when it comes to dental work. This is the easiest way